And welcome to Anatomy and Physiology 1. Today we're going to be working on studying the muscles that are responsible for the expressions of the face and mastication. Mastication is a physiological term for chewing, and so we're going to look at the different muscles. I'm going to show you their origin, insertion, and action. So first I want to define the term origin. Origin is the attachment point of the muscle that doesn't move. And so I like to think of it as like the beginning of the muscle. Insertion is the portion or the attachment point in which the muscle will move. And in the case of the face, the insertion may not necessarily be a bone. It may be a portion of the skin, another muscle, or like some sort of tissue or fascia. And then action. Action is what the muscle does. And so that's what we're going to be going over today and kind of looking at the insertion, origin, and action and seeing how they relate to each other. So the page that I'm on is page 361 in your textbook. We're in chapter 10, where we're going to be looking at the muscles. So let's talk about these muscles. Okay, so the first muscle that we're going to look at is a buccinator. It's a muscle that is located right at your cheeks, and its origin is going to be the alveolar margin. Alveolar margin is like near our teeth of the maxilla and the alveolar margin of the mandible. So the muscles are going to start here and here, and it's going to insert into a muscle called orbicularis oris. Orbicularis oris is a circular muscle that surrounds the mouth, and so it's going to insert into the corner of the orbicularis oris, and its job is to compress the cheeks. And so it kind of sucks your cheeks in, and if you contract it strong enough, it can create the fishy face. So hopefully I can make this video a little funny, and so it'll help you remember, and you guys can follow along with me to be able to learn via muscle memory what these muscles do. So we compress, so the buccinator compresses the cheeks. Then we have a pair of muscles, depressor labii inferioris and levitator labii superioris. And these two muscles are going to bear the teeth. So let's talk about how they do that. So the depressor labii inferioris is going to originate in the mandible, kind of right around here, between the anterior midline and the mental foramen. So it's going to originate there, and it's going to come up and insert into the skin of the lower lip. So that's why it's called depressor labii inferioris. Labii means lips in Latin, and inferioris means lower, kind of lower lip, and so that's what it's going to insert into. Depressor means to pull down. So this is going to pull down the lower lip. So it'll pull down like so. So it'll depress the lower lip. The levitator labii superioris, on the other hand, is going to kind of pull up the upper lip. And so its origin is really going to be near the orbit of the eye over here. And it's going to insert into the muscle orbicularis oris, so the muscle that surrounds the lips. And what it's going to do is it's going to pull up the upper lip and kind of bare the teeth, like so. If we just want to contract one, we can do kind of the Elvis snarl. So that's one or the other, but it usually would contract both at the same time. It's a muscle that's used a lot to show the facial expression of disgust. Disgust is one of the few facial expressions that is asymmetrical, and so it is interesting in that way, and it uses that muscle to kind of curl up one side of the lip. And so to show that facial expression. Two other muscles that are going to be kind of paired for the lips, there's going to be the levator anguli oris, and the levator, so that's going to go up this way, and then the depressor anguli oris. Anguli meaning that they're going to go to the corner of the mouth, and they're going to pull just on the corner of the mouth. So where is the origin for the levator anguli oris? So it's going to originate in the maxilla over here, right under the infraorbital foramen. So that's where this muscle is going to start, and it's going to insert into the corner of the lips. And so when this muscle contracts, it's going to pull up, and it's going to create a smile. You're feeling it pull up. The depressor anguli oris, on the other hand, is going to originate in the mandible and then insert into the corner of the lips. And it's going to, again, kind of insert there and pull the corner of the lips downwards. So it'll be responsible for making a frown. Okay, so levator anguli oris will make us smile. Depressor anguli oris will make us frown. Yeah. All right. There's the zygomaticus major and minor. They're also going to help with smiling. The zygomaticus major and minor are going to originate in the zygomatic bone, so that's where it gets its name. The major is going to insert into the angle of the mouth, and the minor is going to insert more medially, kind of into the top lip, and so together they'll help us smile. Kind of pull up the lips as well, rather than just doing the corner. The minor will pull up the lips as well. There we go. So we can have like 4 muscles kind of help with smiling. The levator labii superioris, levator anguli oris, zygomaticus major, and zygomaticus minor all will help us smile. Jeez. Okay. 2 more muscles. We should go through the orbicularis oris next. The orbicularis oris is a circular muscle. Orbicularis refers to the muscle's shape. All of the fascicles are concentric around the lips, and oris meaning belonging to the mouth. So the orbicularis oris is going to help close our mouth. And it can do this because its origin is the maxilla and the mandible. That's where it's going to start. And it's going to insert into the lips, and it's going to close our muscles in a rounder way. So if you close it gently, or if you contract the muscle a little tighter, it can create the kissy face. Yeah, so that's how I say goodbye to my nieces when I'm on Skype. We go, mwah. And so that is kind of cute. So orbicularis oris. 2 more muscles now. Mentalis. Mentalis is going to be a muscle that is located here. You have 2 of them, so they're bilateral. They're actually going to originate in the incisive fossa of the mandible, so it's going to originate close to the teeth, and it's going to insert into the skin of our chin. So it's going to go down this way. And when we contract, it's going to pull our skin up and it's going to kind of wrinkle the chin. So it's going to make almost a pouty face. So you can see when I'm contracting the mentalis muscle, it's going from smooth to very wrinkled. I want my cupcakes. I don't know. That's a weird way I remember it. And the last one is the rossoris muscle. The rossoris muscle is a horizontal muscle that is going to go from the tissue that surrounds our salivary gland. It's going to originate over there, and it's going to insert into the corner of our lips. And what it's going to do is it's going to pull our lips laterally. So it's going to pull our lips out. Out. So that's the rossoris muscle. That one muscle is really cute. I like it a lot because people who have a short rossoris muscle actually have dimples. So the skin of their cheek kind of folds because it's a little short. I think it's adorable. So yeah. So those are going to be the muscles that are going to control the mouth. Let's go to some of the muscles that are going to control the eye. There are 3 listed here, but I'm only going to focus on the orbicularis oculi. Again, we have another orbicularis muscle, meaning that the muscle is circular and the fascicles are concentric. And oculi is going to be the possessive form of eye in Latin. So oculus is eye. Oculi means it's possessive, it belongs to. So this is the circular muscle belonging to the eye. And so this muscle is going to kind of go around each eye, and there's going to be concentric fascicles that go around. Its origin is going to be the frontal bone and then the maxilla. And when we contract this muscle, it's going to cause us to blink. So the origin is going to be the frontal bone and the maxilla. The insertion is the skin of the eyelid. So it'll make us blink. Okay. Okay. So then we have 2 muscles of the nose. And to be perfectly honest, I'm not good at contracting these muscles in isolation. I'll try my best, but most likely I'm just going to create a silly face. Which I have been doing already, but in a more controlled manner. The first one is procerus, and that's going to start at the nasal bones over here. So it's going to start at the top, and it's going to insert into the aponeurosa at the bridge of the nose and the skin of the forehead. And it's going to move the nose. It's going to kind of move it. See, I told you I'm not very good at this. It kind of helps it kind of helps pull the nose up a little bit when you're talking and expressing, and it's also going to change the shape of the nostrils. Nasalis is also a muscle associated with the nose. The nasalis muscle is going to kind of go over the bridge of the nose, if you can see in the diagram. It's going to originate, its origin is going to be kind of the maxilla and the kind of the cartilages of the nose. So it's going to be more on the sides of our nose over here. And they will insert into the bridge of our nose. And so it's going to help kind of compress the bridge of our nose and depress the tip of our nose. So it'll kind of bring our nose kind of forward. A little bit downwards, and it can elevate the corners of our nostrils. So it can actually flare our nostrils. So something like this. So that would be the nasalis functioning. So you can see the nostrils flaring, the tip is going down a little bit. This is getting a little bit compressed over there. So those are going to be the muscles of the nose. Then we have 2 muscles of the scalp, in our notes, we're going to just be using the frontal belly or the frontalis, but there's also the occipital belly that is important to talk about, and so that one will be more FYI. So the frontalis muscle or the frontal belly is going to originate at the epicranial apaturosa. There's a flat sheet of dense fibrous connective tissue that is going to cap the top of our head. An aponeurosis is essentially like a tendon, but rather than being thin and round, it's going to be a flattened sheet. So it's just essentially a flat tendon. Just give it a different name because we like naming things in Latin. That's what we do, you know? And so this would be called the epicranial aponeurosis. It's going to be look like a white sheet in your textbook. And the frontal belly is going to originate there. And its insertion of the frontal belly or the frontalis is going to be the eyebrows or the skin of the eyebrows. And so when the frontalis contracts, it's going to raise our eyebrows up, like so. So we have the frontalis originating at the epicranial aponeurosa, inserting into the skin of the eyebrows and raising our eyebrows up. The occipital belly is going to be more posterior. Makes sense. It's going to be attached to the occipital bone. And where that's going to originate is actually going to be in the occipital bone. And it's going to insert into the epicranial aponeurosis. So it starts at the occipital bone, inserts into the epicranial aponeurosis, and it will pull the aponeurosis down, and it will cause the aponeurosis to be tight and taut, which is nice because then the frontal belly or the frontalis can use that aponeurosis as a point of insertion and use it as its origin. So the occipitalis is going to pull the epicranial aponeurosis down and taut. The last muscle that is on page 361 is going to be the platysma. The platysma is a muscle that is going to be superficial on the neck, and it's going to originate kind of at the second rib over here and the acromion of this scapula. So it's going to be like on the chest area over here, and it's going to come up and insert into the mandible and the skin of the cheeks. So it starts here and comes up over here. And its major job is to keep the skin of the neck tense. And it can also play a small function in depressing the mandible and actually depressing the lower lip. So I'm going to kind of reveal my neck a little bit. And when I contract, you'll see that this whole area will tense up, and the skin on my jaw will also tense up. So you can see the platysma is tightening the skin. All right, so those are the muscles of facial expression. So be sure to practice them, look at yourself in the mirror. What we're going to do now is we're going to go to the muscles of mastication, so the muscles that are responsible for chewing. There are 4 of them, and so we're going to be on page 363 of your textbook, your lecture textbook, and let's go through these muscles together. So I'm going to sit like this, so because many of the muscles for mastication are more posterior. So the first muscle is the masseter. The masseter is going to sit right here, kind of in front of our ear. Yeah, so like right here. Its origin is the zygomatic arch, so our cheekbone, and it's going to insert into the mandible, the lateral surface of the ramus of the mandible. So it's going to go into the ramus. And so it'll start here and insert into here, and it's going to pull upwards like so. So its job is to elevate the mandible, so bring the mandible upwards and close the jaw. You may not be able to see it too well, but if you clench your jaw, you'll see the masseter muscle will actually kind of bulge out a little bit. I would actually put your fingers on your masseter and clench your jaw to be able to actually feel that muscle contract. The second muscle that is responsible for mastication is the temporalis. The temporalis is actually going to be attached to your temporal bone up here. You'll see in your textbook it's a fan-shaped muscle, and its origin is the temporal bone. This muscle will actually thread through your zygomatic arch. So it'll thread through your cheekbone, and it will insert to the coronoid process of the mandible. Remember, there was a triangular shaped process in the mandible located over here. It's going to insert into there and elevate the mandible, so it'll help with chewing as well. It's going to be a little bit more difficult to see because my hair is in the way, but if you place your hand here and clench your jaw, you'll actually feel the muscle contract. And I'm going to move my hand away. Maybe you'll be able to see the muscle contraction like right over here. So those are two really strong muscles of mastication. Then we have the pterygoid. Sorry, my brain. Pterygoids. The P is silent because yay for Greek. It's a Greek word. There is a medial and lateral one. And its origin is going to be the lateral pterygoid plate. So it's going to be an area that is under the zygomatic bone and kind of posterior. So I would check out the lab manual. I'm not going to be able to explain it very well under all of this tissue. Shy. And it's going to insert into the ramus of the mandible. So that's where it'll insert into. The medial one is going to elevate the mandible and kind of bring the jaw upwards and closes the jaw. And that's what happens when you contract both of them simultaneously. It closes the jaw. If you contract one or the other, it can allow your jaw to move side to side. The lateral one, on the other hand, actually opens the jaw, and it actually can cause the jaw to protrude forward or the mandible to protrude forward. This is called protraction in anatomy. So it'll help you protract your jaw forward. And lastly, it also helps, the lateral one will move your jaw side to side as well. So thank you for watching. This has been our video about the muscles that contribute to facial expression and mastication, chewing. If you have any questions, don't be shy. Just leave a comment in our classroom chat and I will be able to help out. All right, have a great day. There'll be more videos. I'll show you later. Bye-bye. Be good to yourselves.